to my athletes, I got one for you. Especially if you like a fighter, you box, get on in here. Your MMA types, get on in here. We got something for you. And it's a big one. You know, we gotta make sure you straight out there. We're talking about Parkinson's disease. And I'm gonna tell you from the jump, this is a lung disease. No matter what anybody say, there's some brain problems, but the primary focus should be on the lungs. That's the root of the problem. This is Charmaine Santier from Lottoriddles, and of course Lear, the Institute of Health Research. Now, I do believe a lot of sports, especially fighting, is too rough on the body. But I don't think that's going to stop anybody from engaging in them. And I do like watching a lot of them. Like, I like boxing. MMA is a little too violent for me. That's too much. But I definitely like boxing. So, let me help where I can. Of course, that's not the only way to get this disease, but a lot of them are affected. We know the famous case with Muhammad Ali. So I kind of want to go ahead and just run through this. Now, nothing against the professionals out there, but if we are to cure something, we have to say something we thought was right previously is incorrect. From my research, along with my decoding, this is a lung disease for the most part. Now, it does affect the brain. The brain has a lot to do with this as well. But the root problem is in the lungs. It's like they're trying to steer you away from where you'd fix the disease, which occurs often. Right? So what I see here is aneurysms. Many aneurysms, definitely ruptured. Now, aneurysms are blood vessels that are damaged. They end up swelling. If they happen to burst, they're a ruptured aneurysm and they start to leak. Well, that's what's happening in the lungs. A lot of people's lungs are very beat up to the point where they're bleeding in their lungs. All right. Now, to keep this simple, because I don't want to throw a bunch of jargon at you. I hate jargon too. The lungs sit in, like, let's say a bag or like an open space, right? That's full of air. The reason it sits in this open space is because when you breathe in, your lungs have to expand. So in this open space full of air, basically, or nothingness, your lungs have to expand when they breathe. So, it's not pressing up against anything. That's why it's sitting in this open space. That's called the pleural cavity. All right. The pleural cavity. But this open space is where the lungs sit in again. So it can inhale and exhale without squeezing against the back of you get what I'm saying? So in that empty space, it is the pleural cavity. That's what it's called. Blood is leaking in it. Blood is leaking from the lungs inside of that open space that it's sitting in. That's only supposed to be space or air inside. That is called a pleural effusion. That's your main problem. The pleural effusion. Blood leaking from out of the lungs into that empty space area known as the cavity. But when you're talking about lungs, people consider it all lungs. So You can just say a person's bleeding in their lungs to keep it, simple, to keep it simple to explain. So what you would have to do, and they're going to advise against this, you have to do surgery on the lungs to patch up the aneurysms, the blood vessels that are bleeding. You got to patch them up so you can stop the bleeding. And then you have to get the blood that has dripped into that open space, the pleural cavity. You have to get the blood out. Any liquid, blood or any other form of liquid that falls into that open space, you got to get that out. That's the pleural effusion. You got to get that out. And that also hinders the lungs from inhaling air because it's taking up the space, basically. You got to drain the blood out of that empty space. So those are the first steps. Patch up the bleeding blood vessels, which are your ruptured aneurysms. That's the technical term. And then you got to drain the fluid in that open area. That's the pleural cavity. I keep saying it because I know some people don't know these terms. That's your first steps. So I was looking up this term when I was looking at this. There's a term called restrictive dysfunction. And it says Parkinson's can cause chest wall rigidity. I think that's what it's called, affecting muscles like the pectoralis and diaphragm. Okay, so which leads to restrictive breathing patterns rather than lung disease. Leads to restrictive breathing patterns. Okay, so the pleural effusion is considered restrictive. It's a form of restrictive dysfunction. And again, that is the root problem of what's going on here. Your lung is struggling to breathe, to expand because of the blood that's occupying the space it shouldn't be occupying. Side note, make sure you're washing your eyes too, especially if you got like saline. Patients tend to have that problem as well. So okay, so we're gonna do surgery on the lungs to fix the aneurysm and stop the leaking. Then we're going to empty the fluid that's in that open space, the pleural cavity. Okay, that's the first steps, which is good. Now, one of the problems I see is when you have bleeding in the blood vessels, bacteria can spread. Okay, so what happens is, especially over time, bacteria spreads with that leak, and that blood goes through the stream and other arteries, which goes to your brain. All right, so the infection that's down there just flows right up. The infection that can be caused just flows right up to the brain and infects the brain. What you need for that is antibiotics. You need to put them on a form of antibiotics. My favorite is Penicillin G, but you put antibiotics to kill all of that infection and the bacteria that's inside of the arteries of the brain. See what I'm saying? So a lot of Parkinson's patients literally have infection in their brain that's hiding in the arteries, your blood vessels. Clean that out with antibiotics. And you want antibodies, TNF, tumor necrosis factor. antibiotics that will stop the inflammation. All right? Let's keep it moving. Well, that's about it, actually. But what you can do to be extra safe is you can check the brain for aneurysms to be on the safe side. I was looking up a lot of their remedies, and it's like they try to avoid surgery in so many ways. It's like, okay, look, I get it's a scam. I get it. But we're about to end that. So my theory, again, this is all theoretical. Surgery on the lungs, patch up the aneurysms, the bleeding, the blood vessels, empty the fluid from the pleural effusion, that open space. Empty the fluid, put them on antibiotics and TNF antibodies. That's my best bet. I bet you'll get rid of Parkinson's disease. I bet you get rid of it. So again, the brain is a part of it. We got to get all of the infection out of the arteries, out of the blood vessels of the brain, and we can bring the people back to normal. We can bring them back to good health. All right? I'm saying I believe surgery is needed in this, and they're going to try not to. Surgery will help cure this. Now, I won't say 100% of the cases, but surgery is definitely needed more than they're letting on. That's part of the cure. All right. So look, y'all got to protect y'all lungs out there. Y'all bleeding in y'all lungs. Y'all getting hit really hard. Let me mention this other part before I get out. There is another way to get Parkinson's, and that's liver failure. Liver failure can also cause ruptured aneurysms or bleeding in the blood vessels in the lungs. So with this disease, whatever can cause bleeding in the lungs, the blood vessels, along with infection, that can lead to Parkinson's. All right. But it's a lot of times it is the sports. A lot of times people's lungs take a beating. It's a lot of rough sports out there. Yeah, but I did want to mention liver because that's another one of the causes. When these blood vessels break in the lungs, I think that's called a pulmonary hemorrhage. I didn't want to overdo all of these terms because I want the average person to be able to understand this. But you can look up pulmonary hemorrhage. Patch them up. Get the fluid out. Get the fluid out of the sac, out of the open space. Antibiotics to clear up all that infection. Antibodies, TNF to stop the inflammation. You should be good to go. Should be good to go. Keep in mind that infection that's in the brain, that's in the arteries of the brain or the blood vessels of the brain, that came from the toxins and bacteria from the blood leakage, that can be in your system a long time. So you definitely want to make sure you get those antibiotics to clear all of that out. And I'm going to leave it at that. I'm up past my bedtime. I've been working hard on this. But I hope that helps. It's just a theory. Lottoriddles Institute of Health Research. Come back and see me.